Hi, good afternoon, everybody. We'll give it a few minutes and we will get started here. Just let folks filter in from the waiting room. So just give us 1 minute. Thanks so much. Great. Well, the number's slowing down, so I will go ahead and get us started so we can take advantage of all of our time here today, but just want to thank everyone for joining us. My name is Louise Bedsworth, and I'm the Executive Director of the Center for Law, Energy, and the Environment, or CLEE. As many of you are aware, CLEE is a research center that really helps to link the expertise and research work that is happening across at the law school at Berkeley, but across campus more broadly, and indeed with partners in other institutions, with audiences including policymakers, businesses, and other interested parties. We work with government, business, and the nonprofit sector to help solve some of our most pressing, urgent problems. And we really focus on translating information into smart and implementable policy solutions. Through our Lunch and Learn series, we host conversations around current and challenging policy issues, share findings from recent reports, and really invite folks in for conversation and discussion. Our Lunch and Learn series is made possible through our partners at CLEE, Hanson Bridget, Oric, Wilson Sonsini, and Water and Power Law Group. Today, we're going to focus on a very timely topic, which is the intersecting issues around wildfire and public health, and how we can address the complex and often conflicting issues that we encounter in this space. CLEE recently explored these issues in a report called Scoping the Public Health Impacts of Wildfire, a Primer for Stakeholders. This was developed with support from the Climate Wildfire Institute by CLEE Research Fellow Kasia Dahlbeck. Today, we are going to hear from Kasia and two policy experts on this topic, and some of the challenges and barriers that are faced and the opportunities going forward as we try to navigate issues around wildfire and public health. The report is a culmination of a collaborative project that was working with an interdisciplinary group of scientists and policymakers on the intersections of wildland fire management and public health. So we're going to start by hearing from Kasia, who will share some of the findings from the report, and then we will move on to two of our panelists, Julia and Patrick. So Kasia is a research fellow at CLEE, where she researches climate adaptation and resilience issues and equity-oriented approaches to climate infrastructure development. Prior to joining CLEE, Kasia worked on international and climate policy issues at academic nonprofits and helped found a climate advocacy organization nominated for the 2024 Earthshot Prize. Following Kasia's presentation, we will hear from Patrick Wright. Patrick is the director of the Governor's Wildfire and Forest Resilience Task Force, where he leads collaborative effort to align federal, state, local, private, and tribal organizations in support of the nation's largest and most ambitious strategy to protect the health and resilience of the state's communities and wildlands. So no small task there, Patrick. Before taking on that role, Patrick was the executive director of the California Tahoe Conservancy, where he managed several interagency climate, watershed, recreation, and forestry initiatives, and launched the Tahoe Fund. And then following Patrick, we'll hear from Julia Stein. Julia is the deputy director of the Emmett Institute on Climate Change and the Environment at UCLA School of Law. There she supervises the California Environmental Legislation Clinic and the Frank G. Wells Environmental Law Clinic, and undertakes a range of policy and advocacy work on environmental issues. Prior to joining UCLA, Julia practiced at multinational law firms where she focused on environmental litigation, regulatory compliance, and land use practice. including litigating complex environmental cases in state and federal court, advising clients on compliance with state and federal environmental regulations, and assisting clients through land use entitlements and development processes. So all very well situated to help us navigate this complex topic. So with that, I will turn it over to Kasia to share some of the findings from the report. Then we will turn to our two panelists, then we'll open it up for Q&A. So I would encourage everyone, as you're listening in, to please put questions in the Q&A function, and we will come to those after these opening presentations. Kasia.
Thanks, Louise, and thank you everyone for joining. I'll be sharing a high-level overview of our report findings as they relate to the policy landscape in California. Let me just share my screen. So this report was published by CLEE and the Climate and Wildfire Institute in May. And in doing so, we set out to scope the problem and really synthesize relevant research and policy action with the purpose of catalyzing future research and policy development on this issue. And while this paper addresses many topics and many different stakeholders listed on the slide, we're focusing in this webinar on high-level policy implementation in the California context. Although, of course, the California policy context works in close partnership with federal and tribal policy contexts on wildfire and health resilience that are covered in more detail in the report. I'll be using the word stakeholders throughout in an inclusive way, noting that everyone in California is in some way affected by fire. So I'll start with the public health impacts of wildland fire, including the physical and mental health impacts of wildfire and some health trade-offs associated with prescribed fire, before moving on to an overview of the state policy landscape and some recommendations for the policy process and policy development in wildland fire management and public health. The public health impacts of wildland fire are becoming an increasingly present phenomenon in the California context. With growing wildfire incidents, this has become a cross-populational issue with significant environmental justice implications that we'll delve into a bit later on. They're concentrated in three main areas: the physical impacts of wildfire smoke-induced air pollution, the psychosocial health impacts of wildfire, and the public health impacts and trade-offs surrounding fire for ecological benefit. The primary physical impact of wildfire smoke-induced air pollution has to do with PM 2.5, which has been linked to asthma, heart attacks, and preterm birth if experienced during pregnancy. The contribution of wildfire smoke to ambient PM 2.5 exposure has been studied to be as high as over 50% in some Western US states. And new research is showing that PM 2.5 from wildfire has potentially higher toxicity levels than PM 2.5 from urban and vehicular emissions due to the high oxidative potential of organic matter. And as wildfires increasingly enter into the wildland-urban interface, they burn residential and industrial infrastructure, which can release hazardous metals and chemicals into the air and water supply, including chemical fire retardants, or coatings on many household and industrial products that slow combustion but increase the toxicity level when these materials do combust. Finally, the dry and windy weather conditions that drive wildfire also facilitate smoke dispersion across jurisdictional boundaries. Some research is showing that the oxidation of smoke particles in the atmosphere can actually alter their chemical composition to even potentially exacerbate health impacts on downwind populations. The psychosocial health impacts of wildfire include the impacts of smoke pollution, as well as the impacts of catastrophic wildfire. Wildfires produce greenhouse gas emissions, including carbon dioxide and ozone, as well as disrupt regional power availability, which can result in a range of public health risks, including the loss of refrigeration for medicines and food, and the loss of electricity to power at-home medical equipment. The mental health impacts of smoke exposure are a growing area of research, but they have been cataloged to include anxiety, depression, and PTSD for those who have previously experienced wildfire-related trauma. There's also a noted trade-off between mental health and physical health in high smoke exposure days, between staying inside and protecting your physical health versus going outside and going about your day, which has noted benefits for mental health. The impacts of catastrophic wildfire are well known, which includes the loss of infrastructure, whether that's power infrastructure, housing, places of employment. And these are associated with significant mental health impacts, including anxiety, depression, and post-traumatic stress. Many of the impacts of catastrophic wildfire are long-term, whether those are mental health or social impacts, such as the loss of employment, community, economic instability, and higher incidence of poverty. There are also some notable public health impacts and trade-offs associated with fire for ecological benefit. This paper focused primarily on prescribed fire, although it also covered other types of ecologically beneficial fire. Prescribed fire decreases the risk of catastrophic wildfire, but also generates PM 2.5, albeit typically at lower levels than wildfire. This creates a decreased health risk landscape compared to wildfire, but is by no means pollution free, which raises multiple questions for future research and governance around smoke management, community engagement, and future policy development. So in terms of key takeaways, California's population has been roughly everywhere exposed to wildfire smoke, and wildfire smoke incurs significant economic costs by reducing labor participation. The most striking effect of this to me is the mediating effect of behavioral responses. So namely, the access of private provision of protection, such as effective filtration and a safe space indoors, is the determining factor of experienced health burden, which makes this an environmental justice issue. You can see that the public health impacts of wildfire tend to really exacerbate structural determinants of health by most harming already marginalized populations. So the combined wildfire and public health crisis requires a mobilization of really interdisciplinary stakeholders, including those listed earlier, among others. A central part of the issue is working with affected communities on the ground to build community resilience. But for the purpose of this Lunch and Learn, we're focusing specifically on the high-level policy perspective and what policymakers can do in California to build equitable health resilience. So I'll give a brief overview of the state policy landscape in wildland fire management and public health to provide some context for our panel later on. If we start with general agency and departmental remits, we have CAL FIRE, responsible for fire prevention and protection, emergency response, the stewardship of natural resource systems. We have CARB, working on regulating air pollution, especially relevant in the context of regulating prescribed fire and providing community smoke protection resources. Cal EPA, besides CARB's work, responsible for emergency response and post-fire recovery, including the removal of hazardous substances, the removal of ash and debris, and monitoring water quality post-wildfire events, as well as CDPH, addressing environmental health through its mission to broadly protect California's public health and providing public health resources for wildfire and prescribed fire smoke. This is not an exhaustive list. It also includes Cal OES, among others as well, as you can see on the next slide. So as we zoom out from these particular agency remits, which are often siloed from each other, we see a complex web of legal and policy actors, which are often operating under different circumstances and parameters. So this includes coordinating entities, most notably the California Wildfire and Forest Resilience Task Force, the state legislature, local air districts responsible for regional air quality planning and permitting prescribed burns, fire practitioners, community-based organizations, including those in unincorporated communities, and other parties. Again, a lot of this work is done in close partnership with the tribal and federal efforts happening on this issue as well. This report identified a series of policy-oriented recommendations, both for the policy process and for future policy development. These are geared for two primary purposes. One, working across silos to facilitate greater intersectoral and interagency collaboration, and two, generating avenues for streamlined policy action to address any bureaucratic slowdowns, considering the pace needed to implement fuel management strategies. So as the main coordinating body on the state level, the California Governor's Wildfire and Forest Resilience Task Force is well positioned to facilitate interagency coordination at the state. Looking forward to hearing more from Patrick on this later. The report also issued some thematic recommendations for policy development supporting equitable health resilience. So these include utilizing existing policy channels to build community capacity and resilience. So expanding things like the wildland fire sector workforce, research and data capabilities in wildfire and prescribed fire, community smoke protection resources, and effective emergency response. Secondly, facilitating the responsible implementation of ecologically beneficial fire that's really grounded in deep community engagement and aligned with community priorities. So this would include public education and outreach, the expansion of research into the health impacts of prescribed fire, and the provision of equitable and accessible smoke protection resources to protect most vulnerable communities. Finally, a thematic area focused on in the recommendations in this paper is building towards systems level resilience in wildland fire and public health, really making sure that we're developing effective air quality regulation frameworks that account for the nuances in prescribed fire and wildfire air pollution, incorporating wildland fire safety into housing and occupational protections, ensuring that people are able to take time off work during high smoke events if they're outdoor workers, for example. And finally, facilitating integrated, equitable governance on multiple levels, from the local scale to the high level state policy implementation. Thank you so much. Please feel free to add any questions in the chat, or feel free to reach out to the report partners if you have any further questions. And with that, I will pass it back to Louise.
Great. Thank you so much, Kasia. And I flipped the order of our speakers. We are actually first going to hear from Patrick, who's going to talk about the work of the task force, and then we will hear from Julia. So I will turn it over to Patrick to introduce the task force's work.
Louise, and by the way, that was a wonderful overview. For those of you who are brand new to the whole wildland fire topic, it might be worth just a few seconds explaining how we got here. I think if you ask most of the scientists and agency managers, point to three factors. One is we've had a century of fire suppression. Forest Service used to have what they call the 10 a.m. policy, which meant that every fire that took place should be put out the following morning by 10 a.m. And they literally followed that policy for decades. As you can imagine, because of that policy, our forests have become denser and denser and denser with each passing decade. And that's made them much more vulnerable to catastrophic fire, higher levels of fire, more extreme heat, fires that reach into the canopy and then go for tens of miles rather than the lower level fires that used to take place. Second, climate change is making our forests drier and hotter. It's increasing tree mortality. It's decreasing soil moisture, which has a huge impact on the rate of spread of fires. And third, we've had much more development, as you know, in the last several decades in fire-prone areas, the so-called wildland urban interface. So we've got a big problem on our hands, and those three factors are what's largely led to this huge increase in what are known as mega fires in the last several years. So one of the reasons why the task force was brought together was to try to better align state, federal, local, private, and tribal resources to address the problem. It used to be each agency largely focused on their own land. State Parks did its own thing, Forest Service did its own thing, etc. But to tackle this problem holistically, we need to scale up. We need to cross agency boundaries. So the task force came together in its latest incarnation 3 years ago. We put together a comprehensive action plan that lays out 99 actions that all the agencies are taking to try to address this problem. And chief among them is to try to increase the levels of so-called prescribed fire, that is controlled fire. We're living in fire-adapted ecosystems. So if we're going to make them safer and more resilient, we've got to rapidly expand the level of prescribed fire. That's a challenge, however, because at the same time, our air quality regulators are saying we need to ratchet down the level of smoke that we're all experiencing. So that's a tough balance to try to strike. I think there's agreement that among everybody that we'd rather have more smaller fires with lower level of smoke than larger uncontrolled fires. but to put that into a common legal and policy framework is not easy. And so that framework, as we speak, is undergoing rapid evolution to try to strike that balance. So that's something we're going to talk about quite a bit more in the next hour or so. But that's the basic framing, is that we need to get the public, the agencies and others comfortable with, one, actively managing our forest, which is a new concept. Two, accepting the fact that we need more prescribed fire in the ground. And third, we need to accept lower levels of smoke in return for not having higher levels of smoke that come with uncontrolled fire. So that's the challenge that's in front of us.
Great. Thank you so much, Patrick. Julia?
Yeah, I'm happy to jump in and maybe provide a little bit of context for some of the regulatory stuff that Patrick was talking about. And I'll say that I come to this space through my work in the legislation clinic. So back in 2020, which I think we all remember as being a really terrible fire season and right in the middle of the pandemic. So maybe just as we were starting to feel like we could leave our houses again, we were pushed back inside by just tremendous amounts of wildfire smoke. And in the wake of that terrible fire season, there was a lot of interest in the legislature in doing something on wildfire, not just wildfire suppression, which has historically been the focus, as Patrick alluded to, but on wildfire prevention and mitigation, which has not typically been the focus of state efforts, and particularly not in Southern California. And so we did some work in the clinic to assess ways that the state legislature could support those kinds of preventative and mitigation efforts. And prescribed burning came to the fore as a really interesting topic, both because of the challenges with public perception of prescribed burning, which, I think even though policymakers are now experiencing kind of a renewed interest in advancing and utilizing prescribed burning as a tool to prevent fire, the public perception of prescribed burning, especially in certain communities, hasn't necessarily caught up with the policymakers on that score, and certainly not in Southern California, where I think there are still real questions about the differences in ecosystems here versus the northern part of the state, and where it makes sense to use prescribed fire as a tool. But one of the things that came out of that research was just a better understanding, and so I'll talk a little bit about the legal framework that applies. As Kasia mentioned, the air districts permit prescribed burning. And we just recently, at the beginning of this year, had our PM 2.5 standard lowered on the federal front. So we have national ambient air quality standards that we have to meet under the Clean Air Act. We had a standard of 12 micrograms and lowered to 9. And so that swept in a bunch of areas of the state that might have been in attainment with the higher standard and are no longer with the lower standard, including areas in the northern part of the state that consistently experience wildfire, and where prescribed burning might be an effective tool to kind of manage and prevent against more catastrophic fire. And, this is a real challenge for regulators. Thinking about how we get these two systems to work together and do what we know we want to do, which is reduce catastrophic wildfire events that create just a ton of smoke, but also comply with the federal standards that apply and the federal framework. And one complicating factor is that wildfire smoke is not man-made, is exempted from counting against being in violation of the national ambient air quality standards. But historically, prescribed fire has been treated as a man-made event that does count, and so can push districts into non-compliance, which comes with a host of sanctions and other ramifications. And so trying to figure out ways to facilitate air districts permitting prescribed burns has been kind of a long project. And those conversations continue, especially with the new standards. But we're also working against some challenging forces here, including climate change, which narrows the window during which it's safe to implement the use of a prescribed burn. So, I think there are a lot of different factors at play here. One is just regulators needing to talk to each other about ways to streamline the process and have it make sense, right, across both fronts, achieving both air quality goals and our broader wildfire prevention goals. But there are also political concerns related to stakeholders in areas where prescribed burns may be being implemented, who are going to be experiencing those impacts from smoke kind of on the front lines and need additional engagement. And will also be engaging with their local air regulators on this score. And, there needs to be communication there as well. So that's just one illustration of kind of the policy landscape and the regulatory landscape that can create challenges in this space.
Great. Thank you both so much. That was really helpful. I'm wondering if we could dive a little deeper into some of the key barriers and challenges that you see, Julia, Patrick, and Kasia, if you want to weigh in here as well from the research you did. Sort of what are some of the key barriers and how do we go about addressing them? So, are they legislative actions? Are they coordination and communication actions? I'm sure it's all of the above, but just would love to hear your thoughts on that.
We can obviously ask that question a lot. What's it going to take to get to our so-called 1 million acre target, which the governor and the Forest Service have committed to? Well, there's three major barriers, really. One is money. And, unfortunately, we're in a situation now where both the state and federal budgets are dropping precipitously after huge infusions of money, both from the federal infrastructure bill and from the state surplus. Second, you need the workforce to get the work done. And the forest sector is struggling with the same workforce issues that the rest of America is. And so that continues to be a problem. And third, you need collaboration, particularly in this space. And just to give you a flavor of that. So you got a prescribed fire that's planned, let's say in the Sierras, east of Fresno, went down and visited such a prescribed fire that was planned a few weeks ago. 2,000 acre fire, 60 people there from 7 or 8 different agencies. It's already a year in the works. It's a year away. And when they plan it, they'll have the engines ready, the crews ready, huge infrastructure ready. And then you have an air quality staffer in Fresno who has to say yes or no on the day. And of course, they want this to be a multi-day prescribed fire that may last for a week. And so that same individual has to sign off on a week's worth, thinking we got a good handle on weather, but maybe not, because there has been a history of a very small portion of prescribed fires that have gotten out of hand. But even though it's only 1 or 2%, those have grown big and have caused a lot of damage. And then of course you have the community that needs to be prepared for the smoke impacts, and the mayor needs to be prepared for those calls, and so are the political folks. So huge amount of infrastructure and effort just to get one relatively small prescribed fire done after a couple of years of preparation. So it's not your typical legal and regulatory framework where you've got a standard and you monitor, did you meet it, did you not meet it? If not, then you take action. This is a very dynamic system that requires a lot of collaboration, a lot of teamwork, and candidly some risk. So it's a real challenge.
Julia?
Yeah, I would echo everything that Patrick said. Those are the challenges, right? And I guess I'll add another, which is just that political interest in this issue ebbs and flows, right, with the severity of wildfire seasons. And so I think we're seeing another wave of interest now as we're coming off of some incredibly wet years, and now we have a bunch of brush built up and we're starting to see a lot of burning this summer. And so those discussions are starting to happen again, but we had a little bit of a lull. We had a cash infusion over the last couple of years, but we had a little bit of a lull in some of the conversations around the need for wildfire prevention funding. And now, even now, as we're starting to see those wildfires rage again, a lot of the focus once again is on suppression, because that's what people want to see when there are wildfires raging. And so, we had Governor Newsom a couple weeks ago do a big press conference in front of a bunch of ex-military planes and helicopters, kind of showing the force of the state able to come out and respond to these wildfires in real time. It's a little bit harder to translate in images like that what all those prevention dollars are really doing, but they're doing a tremendous amount to avoid huge losses to property, to life, and these long-term public health impacts. And so kind of being able to strike while the iron is hot when there's political interest in these issues, I think is really important.
Can imagine the communications battle we have when you've got not just the governor, but all sorts of people behind those shiny new, tankers, talking about their commitment to put out, fire, keep people safe. You didn't hear during that message that we need more fire on the ground, but we do. And so, but on the other hand, we do need that force. I mean, there are thousands and thousands of fires taking place. So nobody's saying we need to take our foot off the pedal in terms of trying to put out fires when it makes sense, but we also have to be smarter. And that means doing more of what's called managed fire, which is that when lightning takes place in an area that's not near a community, to manage it to more effectively treat basically the forest. Again, that's a tough message. It sounds like a mixed message, and in some ways it is. And so we really have a lot of work cut out for us to be able to both send a message that we're prepared to fight fires, but we're also prepared to manage fires. It just makes the whole planning framework that we're working under just all the more challenging.
Yeah, and I think the current budget landscape too really drives this home. I mean, we've historically seen a huge difference in resources for suppression versus prevention, with suppression getting the great majority of the resources, and that continues to be true, even though there has been more of an effort to provide resources for prevention and mitigation in recent years. But you kind of see that playing out in the process even now. So we have a big bond that just got qualified for the November ballot, and a lot of the prevention funding has been shifted into that bond. So there's, of that $10 billion bond, 1.5 billion of it is for wildfire prevention, but it's going to the voters, right? It might pass or it may not. And whereas, you see suppression continuing to be very well funded in the budget because of that perception of immediacy and the need for that funding. And so, I think the environment that we're in kind of highlights that difference.
Yeah. A question actually for you, Julia, going back to something you spoke about on the PM 2.5 issue and the difference between sort of naturally caused or started fire and a prescribed fire, and how it's counted towards air quality attainment issues. Do you see a pathway to change that? Like, would that have to be at the federal level that the US EPA would need to make that call, or do you see that being a barrier that will just stay in place in terms of how we are able to utilize prescribed fire?
Yeah, so there is actually a carve out. So there is already a pathway for prescribed burning. It can qualify for an exemption from that classification, but certain conditions need to be met. And, as Patrick alluded to, there are a bunch of hurdles that you have to jump over. And that includes a thumbs up or thumbs down on the day of the burn itself. So you're very much monitoring the situation in real time, which is really different from lots of other regulatory frameworks. And so it's not to say that it's impossible to undertake prescribed burning, but just to say that there are some more barriers to that, and that I think that framework, the underlying framework, really speaks to underlying public perception issues related to prescribed burning, and reticence of air district officials who at the end of the day are the ones making the judgment call. They're getting already a large volume of requests to undertake prescribed burning with limited resources to process all of that. And it's a tremendous amount of work. And at the end of the day, it also involves some level of understanding what the interests of community stakeholders are and what the effect is going to be in the local air basin. And that really just varies and is an issue that kind of has to be dealt with a lot of stakeholder engagement and outreach.
I think inevitably, I mean, we're in a transition period now where up until 5 years ago, it was all about, in addition to just putting out fires, thinning. The Forest Service basically has, in many ways, supplemented their traditional focus on timber and lumber with fire protection. And so mainly through thinning. Now we're in a period where we're ramping up prescribed fire significantly, and managing fires that take place naturally is happening, but very few and far between. What you're going to see, partly because of this framework, because it is so complicated to get a prescribed fire in place legally, politically, everything about it, there's going to be an evolution towards managed fire. Because when you think about it, you already have all your crews, you have everybody out there, so it's a lot cheaper to manage a fire that's already taking place, and there are no regulatory restrictions at all. No permitting, so of course we're going to move in that direction. Having said that, that's the most controversial policy of all, and is practiced not at all in most of the other Western states because of the fear that you're just letting it burn. And candidly, there just isn't trust that the agencies know how to do that well. But inevitably, the policy, legal, and cost framework are going to be moving us in that direction. We're not there yet, but I would predict in a decade, most of our acres are going to be treated by managed fire.
Great, thank you. I know we're getting a few questions in the Q&A. So maybe quickly before we turn to those, ask you all both, and Kasia, you as well, especially on the research side, what opportunities you see in the coming years to really sort of navigate and address these issues. I mean, you heard, Patrick, you indicated a sort of trend towards more managed fire. I'm curious also on the policy and budget side, research side, what kind of opportunities you all see.
Kasia, I don't know if you want to jump in on this one.
I can start on the research side. There's a tremendous amount of future research that's needed into virtually all aspects of this issue, broadly grouped into scientific research, social research, and policy research. On the scientific side, we really need technical research into the impacts of smoke plume distribution, their impacts on health, epidemiological research into differential health impacts between prescribed fire, wildfire, prescribed fire and wildfire under different conditions, their impacts on different populations, their impacts cumulatively. Most scientific research on this issue looks at exposure on a really short-term basis, but what we're seeing population-wide in California is long-term exposure, and we really don't understand well the impacts of that. On the social side, we need better research into the social feasibility of prescribed burning, social acceptance of prescribed burning, its impact on communities and community engagement on those issues. Communities are really emerging as such a key actor in the development of this dynamic space. And And we, as policymakers and researchers, don't have very much understanding of what communities' needs are in terms of prescribed fire and understanding and acceptance on a local level. And finally, policy research into implementation. The regulatory frameworks, as everyone has mentioned, are very complex, sometimes at odds with each other, and exist at the intersection of multiple levels of frameworks. So we need policy research into avenues for implementation, whether those are specifically policy focused or legislative, and on a state level as well as on a federal level, as most forested land in California is federally owned.
And I think I would add to that list too. I mean, Kasia, you alluded to this a little bit, but you know, at the end of the day, and so much of what we've been talking about is budgetary decision making, and better understanding kind of the avoided costs that come with implementation of prescribed fire is really important. And we have some studies that start to talk a little bit about productivity loss or excess mortality as a result of wildfire exposure. But I think decision makers could really benefit from more and better data and a stronger understanding of really what are the associated costs, because, you know, when you look at suppression, you're seeing real-time costs, and I think understanding, you know, what costs we are avoiding through prevention efforts, particularly when it's through the use of prescribed burning rather than just environmental wildfire burning, is really key.
Let me just second that. You know, somebody who fights the budget battles every day, having more ammunition. I mean, the few studies that have been done have shown that by far the biggest economic impact of these fires has been the public impacts of smoke and economic impacts. When in some of our biggest fires, you had, you know, scores of companies in Silicon Valley shutting down as well. So it's not just public health, it's a huge impact. And I also think politically, it makes a huge difference. You know, candidly, wildfire is viewed as a rural issue in California, and there aren't very many votes in rural areas. And so when people have asked me, like, what's going to turn the tide on funding? You know, the perception has been forestry projects pay for themselves through lumber. Well, that doesn't do the job in terms of what we need. What's going to turn the tide, candidly, is smoke in urban areas. Because most of our legislature is made up of folks, you know, in the Bay Area and Southern California, and smoke matters. And so I do think it's a combination of the research, the monitoring, the economics, and just the awareness of just the incredible impacts that smoke is having. I think in the long run may make as big a difference as anything in securing the resources we need to do a better job on the prevention side.
Great. Well, maybe I'll turn to a couple of questions that we have in the Q&A and would encourage folks to continue to drop them in. And maybe I'll start this one with you, Patrick, just because you touched on it before, which is around forest thinning. And you mentioned that managed fire is one of the most controversial policy options. Forest thinning has not exactly been smooth sailing either. And so I'm curious if you could just speak a little bit more about the role of forest thinning, how useful it has been, and some of the challenges and opportunities you see with forest thinning as a strategy.
I mean, certainly traditionally, you know, forest thinning or, you know, timber production has been very controversial in California. A lot of us lived through the timber wars. Those days have long passed. I think the Forest Service in particular, which manages most of the public forest land in California, is no longer doing clear cutting, is, you know, doing everything they can to save what old growth forests remain. And so thinning is a lot less controversial. You have big conservation groups like the Nature Conservancy, which owns a lot of land itself, solidly behind what they term ecological forestry, recognizing that through fire, our forests used to be a lot less dense than they used to be. So we now have which we did not have a couple of decades ago, a coalition of conservation groups and scientists squarely behind doing thinning and prescribed fire. Usually what they'll tell us is that you need to start with thinning, because if you do prescribed fire first, the forests are so dense, it's too hard to manage. So most of our scientists and conservation groups are recommending that you do modest levels of thinning of small diameter trees, not large trees, usually trees that are 15 inches or 16 inches in diameter or less. That's the highest priority for thinning. Leave the larger trees behind, and then supplement that thinning with prescribed fire later. There's a remarkable level of consensus on that now. There are a few outliers, groups that still want to fight the old battles, that get a lot of airplay, because it is this romantic notion, just leave our forests alone, we're good. It's just another one of our education battles that we're facing to get people used to the fact that the science has really changed on that.
Great. I don't know if anyone has anything else to add. Otherwise, I will turn. We have two questions. I'll kind of combine them because they're quite related, which is around the role of technology and how can technology help with, whether it is, making burns safer, monitoring the air quality, figuring out sort of how we target and utilize fire. I'm curious what you all are seeing in that space.
I can jump in first. I think on both on the suppression side, the advances have just been enormous. We now have hundreds, if not thousands, of cameras throughout the entire state. It actually started in Lake Tahoe, what's called Alert Tahoe, where they put cameras on all the peaks. That now has expanded. It's called Alert California. So the level of technology is just amazing, where you can have a person sitting at their laptop, you get a whiff of smoke, and immediately that gives the person where it is, what the wind is, what the soil moisture is, what the weather is. It's an astonishing level of information that was unheard of as recently as 5 years ago. And then on the forest health side, through satellite imagery and through other techniques, we now can know the health of every parcel in the state of California down to 3 meters. How dense it is, what the structure is. It's really extraordinary. So it's given us great ability to put that information in the hands of planners throughout the state who are trying to plan projects to determine, where the best places are to give us the biggest bang for the buck in terms of fire protection. So there's no question technology is creating wonderful opportunities on both the suppression side and the prevention side.
And then maybe I'll speak to a slightly different angle, which is risk mapping. So which there has been a lot of renewed interest in, especially in the conversation around insurance lately. And we haven't talked very much about that. But we do have, through improved satellite technology and the use of drones, an ability to do more granular risk mapping than we have historically, and shifting our understanding of where risk is heightened, I think, is going to have a major impact in the insurance conversation. And there will be public health kind of fallout from that. The ramifications of that are gonna be probably shifting demographics in different areas of the state, and that in turn affects not only who's experiencing acute smoke exposure from wildfires, but also access to housing, access to healthcare as broader issues. So I think that's gonna play out in that space as well.
I'll add yet another angle, which is the huge role of technology in navigating the complex regulatory landscape, and specifically in navigating the EPA's exceptional events process, which Julia talked about earlier, where AI tools allow local districts to categorize smoke plumes much quicker, which allows them to move through the various hurdles needed to categorize a prescribed burn as an exceptional event much faster than they would otherwise, which has potential to significantly speed up the process and really counteract the effect of those lowered ambient air quality standards earlier this year.
Great, thank you. Another question for you all, which we touched on, and I won't, I think we all know the volatility and especially the recent cuts in the California state budget and the implications that has for wildfire resilience, other resilience programs more generally. And I think there's a pattern of a feast and famine budget cycle generally in California. So I'm wondering, looking ahead, you mentioned the climate bond. What do you see as opportunities in that space as well around funding for this kind of work, and thinking about some of the innovative financing tools that have been piloted and things like that? I'm just curious if you all have thoughts on how are we going to sustain the funding we need to do this work, and the role of the public and the private sector in doing that.
Question. As I mentioned earlier, I think in the forest world, traditionally, timber projects generated the revenue. There wasn't a lot. Yes, the Forest Service has some funding that goes into their projects nationally, but until these big infrastructure bills pass, candidly, not a whole lot. As Julia said, most of the budget's on the fire suppression side. On the state side, we've been through a series of nearly a dozen natural resource bonds in the last 20 years, and it's only the last two that have had any money for fire and forest health. And so I think a part of it in turning the tide is educating people that spending money on forest resilience has multiple benefits. It's not just preventing wildfire, but it's having ecosystem and biodiversity benefits, water benefits, carbon storage benefits. The more we can tell the story on the multiple benefits of it, the more successful we are going to be in opening up additional funding sources. There's also a lot of work on if we can better quantify things like the water supply and avoided costs of reservoirs filling up with silt, that water districts will be willing to pay more, and we can get more carbon credits if we can generate better information on the carbon storage benefits of some of these projects. So a lot of work is being done in the so-called ecosystem services field to better quantify the various benefits of forest thinning, and then seeing if we can find beneficiaries who will then pay for those, whether it be private companies seeking credits, utilities. So a lot of work being done in that space. And then finally, we're just beginning to talk to the utilities. A lot of people are not aware that the utilities are actually spending far more than the public agencies just to deal with the issue of reducing ignitions from their network. And so we've got to do a much better job than we have in coordinating our efforts with the utilities and sharing our resources there. So it's a great question. We need to do a lot more to broaden the sources of funding beyond our traditional sources.
And I'll say that in addition to quantifying the benefits, quantifying the costs, I think can be very helpful in that space as well. And so, going back to the need for additional research in that space, I think that also really helps make the case that, there are going to be some serious costs avoided by making that investment.
Great. Well, we have just a few minutes left, so maybe I'll ask each of you to sort of give a 1 minute or thought on where you see, if folks are interested in this is a very complex topic, if there's something they want to be following to look for progress, are there key policy actions or activities that you think people should be paying attention to over the next, year or two? Or research activity, or anything in this space that people could sort of follow to understand how we're doing?
Well, I can start with the policy front. The policy front, we're updating our action plan. We hope it'll come out, a draft will come out next spring. We're taking the 99 actions that were in the plan 3 years ago, and this time it's going to be much more strategic and much more regional. So you'll read that the approach that we're taking in the Sierra Nevada A lot more prescribed fire, a lot more thinning is not necessarily the right approach for Southern California, where there's much more of a emphasis on ignition reduction. So look for the update of our action plan to be probably the major focus, at least on the policy front. There's also various work groups that are working on prescribed fire, fire adaptive community strategies, et cetera, that are moving along. But the plan update, I think, will be the biggest impact in this space in the next few years.
Yeah, and I would say, I mean, just continuing to follow and monitor legislative developments in this space and, you know, how consistent the interest is in prevention and really keeping the focus on that piece of the puzzle as well. And then kind of highlighting the need for community engagement and outreach on these issues, because I think, you know, getting the message out and helping folks understand the need and again, the avoided costs from this type of activity, I think is really going to push the conversation forward.
And I'll add the real diversity of academic research that has expanded in this area in the last few years across a variety of different fields, alongside a variety of interdisciplinary initiatives, working on bridging the academic research to policymakers and making sure that that data does get communicated to government and to the public. So whether that's following our work on it at CLEE, or I know UCLA's climate research or climate and wildfire research initiative has started launching a variety of interdisciplinary work on climate and wildfire. I would expect there to be many more similar groups cropping up along those lines going forward.
Let me just quickly add, because of that interdisciplinary nature, groups like CLEE and this work is so vital. Agencies are in their silos, and having people on the outside pushing the envelope, having sessions like this, launching research is great. So I just want to say thanks to CLEE for the work you're doing in this space to bring together the various parties on this.
Great. Well, thank you. It's glad to hear that is helpful, and that is what we hope to do. So we are glad to be doing that. And I want to say thank you, Julia, and the work you guys are doing at Emmett, and Patrick for joining us today. I know you've got your hands full. It's a busy time of year. And Kasia for the excellent work on the report. And thank you to everyone who attended this afternoon. We really appreciate you taking time. I also want to thank our partners, Wilson Sonsini, Oric, Hanson, Bridget, and the Water and Power Law Group. And I also want to make folks aware we have 2 other Lunch and Learns coming up. Tomorrow, we will be joined by Dan Farber and Sharon Jacobs, 2 environmental law professors at Berkeley, to talk about the implications of the Chevron doctrine decision coming out of the Supreme Court and what that means for climate and energy law. And then next week, we will be hosting a hybrid lunch and learn to look at climate-related financial risk disclosure. And so encourage you all to look on our website and register for those events as well. Thank you again to everyone for joining us today. And Julia, Patrick, Kasia, thank you for the excellent conversation.
Thank you.
Thanks, Louise. Thanks all.